Thank you, Chairwoman Fox, Ranking Member McGovern, and members of the Rules Committee for the opportunity to once again testify on this big budget scam. I'm here today on behalf of the hardworking constituents of Washington's 6th Congressional District, including more than 27,000 federal employees. I'm here on behalf of the 1.8 million low-income children and adults who rely on Medicaid in my home state. But I'm also here today on behalf of the 72 million Americans across the country who rely on Medicaid. Because what has been made abundantly clear in the last few months is that those Americans who live in states with Republican leadership are not being listened to by their members of Congress when they are sentenced to losing their health care. A senator from Iowa, in response to concerns from her constituents at a town hall over Medicaid cuts, said, "Well, we're all gonna die." Apparently, she doesn't care that 700,000 Iowans rely on Medicaid or that 36% of Iowa's children rely on Medicaid. The senator from Kentucky said they'll get over it. But does he know that 1.4 million Kentuckians rely on Medicaid and that 44% of the births in Kentucky are covered by Medicaid? Medicaid covers also 68% of the nursing homes in Kentucky. I guess the senator isn't worried about selling out those constituents because dead people can't make phone calls and turn up at town halls. The senator from South Carolina, as recently as this week, said we aren't cutting Medicaid, which is an outright lie. In South Carolina, 1.3 million children and families rely on Medicaid. And yet, after passage of the bill this morning, he said, "I feel great." The gentleman from Louisiana's 4th District said, if you're going to be on the public wagon and you're able, you should try to help pull it. He also claims that Medicaid cuts are teaching a moral lesson to young men. 1.8 million people rely on Medicaid in Louisiana. Rural hospitals in his district, who also rely on Medicaid to keep their doors open, have been begging him to change his mind. I'm here because I actually listen to my constituents. I'm listening to Larry from Aberdeen, who wrote to me saying, I urge you to reject the Republican reconciliation bill, which would inflict severe harm on rural communities. Many families in these areas already struggle with lower incomes and higher levels of hardship. These cuts would exacerbate poverty and threaten local economies by risking hospital closures and declining businesses for local retailers. Protecting rural communities should be a priority. Do not support a bill that prioritizes tax cuts for the wealthy over the basic needs of our family. And I'm listening to Jessica from Tacoma, who said, I'm reaching out today to urge you to protect Medicaid. My daughter is one of the 80 million Americans who depend on Medicaid for health coverage. She's developmentally delayed, autistic, and profoundly deaf since birth. Without Medicaid, not only will she not have health care, but she will also not be able to work. She's a janitor who cleans public restrooms, but she needs a job coach to enable her to remember what to do. With the job coach, she does her job very well and has even won an award for efficiency. But Medicaid pays for the job coach. Congress says they want people to work. Please don't let them take away that ability from my daughter and people like her. I've filed 8 amendments with this committee, including one that would strike the entirety of the Medicaid provisions from this bill. The Vice President said that the minutia of the Medicaid policy is immaterial compared to the ICE money and immigration enforcement provisions. If that's the case, then there should be no problem removing these Medicaid provisions that will result in people literally dying. I also feel compelled to add that in this discussion about who is able-bodied and who is not, I think we haven't heard anyone comment on how frequently you have to recertify that you are disabled in order to continue receiving federal benefits. I have experienced that in my family's life. My sister was born with extreme developmental disabilities so that she was like an infant her whole life. And yet, over and over, for the course of the 19 years that she lived, we had to continue to prove that she was disabled enough to qualify for the benefits that kept her alive. We cannot ignore what we are doing to people in this country, and I urge the committee to make my amendment in order and to adopt it to save millions of lives. I yield back.